Welcome to the instructions for use for the Puregon pen. This presentation will guide you through all the steps necessary to use your Puregon pen. The four main steps are before you begin, preparing for your injection, giving your injection, and after your injection. You should also read the instructions included with your Puregon pen and cartridge pack. If you have any further questions about Puregon, Folitropin Beta, or the Puregon pen, write them down and ask your doctor or nurse during your next visit. Note that some of the wording in the Puregon booklet specifically addresses the major group of users who are on a daily treatment regimen. If your doctor has given you other instructions on your treatment regimen, always follow his or her instructions. This is what you will need to prepare for your injection of Puregon: a Puregon cartridge in a sterile recyclable tray, your Puregon pen, one of the microfine pen needles that comes with your Puregon cartridge, some alcohol swabs or pads, sterile gauze, and antibacterial soap. Puregon cartridges should always be stored in a safe place out of the reach and sight of children. The Puregon cartridge can be stored in the refrigerator at 2 to 8 degrees centigrade. Do not freeze until the expiration date on the cartridge, or alternatively, at or below 25 degrees centigrade for 3 months or until the expiration date, whichever occurs first. Puregon, however, should be preferably injected at room temperature, so remember to take the cartridge out of the refrigerator a few minutes before you're ready to give yourself an injection. Please note, however, that once the rubber inlay of the cartridge has been pierced by a needle, the cartridge can only be stored for a maximum of 28 days, between 2 and 25 degrees centigrade. It is also important to protect the Puregon cartridges from bright light. Puregon cartridges are available in 3 strengths: 300, 600, and 900 international units of recombinant follicle-stimulating hormone, or FSH, per cartridge. The colour of the metal cap indicates the contents of the cartridge. A silver cap indicates 300 international units, or IU. A gold cap indicates 600 IU, and a dark blue cap indicates 900 IU. In this program, we will demonstrate how to inject a dose of Puregon using the 600 IU cartridge. Your doctor will have prescribed the appropriate cartridges for your treatment. Always wash your hands thoroughly with antibacterial soap and water before you begin. At the start of your Puregon treatment, and each time you need to change a Puregon cartridge, you take your Puregon pen and remove the cap from the pen by gently pulling it off. Unscrew the body from the cartridge holder and put it aside. For the next step, you need the yellow cartridge holder and a Puregon cartridge. Use an alcohol swab to gently wipe the metal inlay on the cartridge. Then insert the Puregon cartridge into the yellow cartridge holder. Make sure that the metal-rimmed cap goes in first. Lower the pen body into the cartridge holder. The black rod must press against the rubber piston on the cartridge. Screw the cartridge holder towards the body, making sure that the arrow falls within the aligned mark. The arrow on the cartridge holder must point to the middle of the yellow alignment mark on the blue pen body. Check that there is no space between the body and the cartridge holder. If there is space, unscrew the body from the cartridge holder and check whether the cartridge has been inserted correctly. Remember not to touch the sterilized cap of the cartridge when placing it back into the cartridge holder. The following steps should be performed every time you inject Puregon using your Puregon pen. To reduce the risk of infection, always use a new sterile needle for each injection. Make sure that the cartridge holder has a cartridge in it before you attach the needle. You can see the cartridge through the window of the yellow cartridge holder. Clean the tip of the Puregon cartridge at the open end of the cartridge holder with another alcohol swab. Take the needle and remove the protective paper seal. To keep the opened needle clean, never touch the exposed needle or place an open needle unit on the table surface. Hold the outer needle shield firmly in one hand while holding the cartridge holder firmly in the other hand, and push the end of the yellow cartridge holder into the outer needle shield. Screw on securely. Puregon cartridge for use with the pen is designed for a subcutaneous injection under the skin. Suitable places for injection include the abdomen, which is the stomach area below the belly button, navel, or upper leg. Your doctor or nurse will advise the best place for you. Try to vary the site of the injection just a little bit each time. Use a swab or a piece of gauze moistened with alcohol to clean the area where the needle will be inserted. Let the alcohol dry for at least 1 minute before proceeding. Carefully remove the outer needle shield by pulling gently while leaving the inner shield in position. Now place the outer needle shield with the open end upwards on the table. Then, carefully remove the inner needle shield and discard. Do not touch the needle or let it touch any surface while unwrapped. Hold the pen with the needle pointing upwards. To prime the needle, tap the cartridge holder gently with your finger to help air bubbles rise to the top of the needle. The remaining presence of small air bubbles won't affect the amount of Puregon you receive. Before dialing the prescribed dose, you need to make sure that the needle is correctly primed. Every time a new, unused Puregon cartridge is loaded into the Puregon pen, always dial the dosage knob until you hear one click. With the needle pointing upwards, push in the injection button. Then, look for the droplet at the tip of the needle. If you don't see a droplet, repeat the previous step until a droplet appears. You must make sure you see a droplet at the tip of the needle, or you may not inject the correct amount of Puregon. For doses from 50 to 450 IU, turn the dosage knob until the correct dosage aligns with the dosage markers on each side of the dosage window. If by mistake you dial past the correct number, do not try to turn the dosage knob backwards, because you will lose some drops of Puregon solution from the tip of the needle. Just continue to turn the dosage knob in the same direction past the 450 mark, as far as it will turn. Then, completely push in the end of the injection button, and redial starting from 0 upwards. If you follow this procedure, you will not lose any fluid. Never dial your dose or try to correct a dialing mistake when the needle is still in your skin, as this may result in receiving an incorrect dose. After setting the device to the appropriate dose, you are ready to inject. Pinch the already swabbed area of the skin between 2 fingers. With the other hand, insert the entire needle straight into the skin. Press the injection button in all the way to make sure you give yourself a full injection. Wait 5 seconds before removing the needle from the skin. Pull out the needle. Firmly press down on the injection site with an alcohol swab. Check that the injection button on the pen reads 0. You have now successfully injected your dose of Puregon. If, during your injection, the injection button cannot be fully pushed all the way in, do not try to force down the button. Your Puregon cartridge is probably empty. This means that you have not received your full dose. Refer to the After Your Injection chapter of this video for more information. In order to avoid injuries, place the outer needle shield on the table with the opening pointing up. Carefully insert the needle, which is still attached to the pen, into the opening of the outer needle shield and push down firmly. Grip the shield and use it to unscrew the needle from the cartridge holder and dispose of your waste safely. A needle should not be disposed of via household waste. Please ask your pharmacist or physician how to obtain a secure container for proper needle disposal. If there is enough Puregon left for further injections, put the pen cap back on the pen body and store your Puregon pen in the refrigerator at 2 to 8 degrees centigrade or at or below 25 degrees centigrade for up to 28 days. After each injection, always take the needle off the pen. Never store the pen with the needle attached, in order to avoid drug leaking and to minimize the risk of contamination. For your next injection, your Puregon pen is already loaded, and all you need to do is attach a new needle and prepare a new area of skin. Then remove the outer and inner needle shields, as shown in Preparing for Your Injection, and simply look for a droplet forming at the tip of the needle. If a droplet forms, then dial the dosage knob until you reach the required dose you need to inject and inject the required dose of Puregon. If no droplet appears, simply follow the previously described step by dialing the dosage knob one click and pushing in the injection button until a droplet appears. See the chapter Preparing for Your Injection. Before removing the empty cartridge from the pen, the needle must always be removed, as shown in Removing the Needle. Unscrew the body of the cartridge holder, put down the pen body and remove the empty Puregon cartridge from the cartridge holder and dispose of your waste. An empty or unused cartridge should not be disposed of via household waste. Please ask your pharmacist or physician how to dispose of medicines no longer required. For the next step, you need the yellow cartridge holder and a Puregon cartridge. Use an alcohol swab to gently wipe the metal inlay on the cartridge. You can now either reassemble the pen without a Puregon cartridge to prepare for your next injection, or put your Puregon pen back together with a new cartridge inserted and store safely in the refrigerator at 2 to 8 degrees centigrade. Alternatively, you can store the pen at or below 25 degrees centigrade. Do not freeze, and be sure to protect from light. Puregon cartridges should always be stored in a safe place. Puregon, however, should be preferably injected at room temperature, so remember to take the cartridge out of the refrigerator a few minutes before you are ready to give yourself an injection. The Puregon cartridge can be stored in the refrigerator at 2 to 8 degrees centigrade until the expiration date on the cartridge, or alternatively, at or below 25 degrees centigrade for 3 months or until the expiration date, whichever occurs first. Please note, however, that once the cartridge has been pierced by a needle, the cartridge can only be stored for a maximum of 28 days between 2 and 25 degrees centigrade. It is also important to protect Puregon cartridges from bright light. By using the treatment diary located in the Instructions for Use manual, you can keep a record of your injections, and you can calculate whether there is enough drug left in the cartridge for your next injection. Note that some of the wording in the treatment diary specifically addresses the major group of users who are on a daily treatment regimen. If your doctor has given you other instructions on your treatment regimen, always follow his or her instructions. The Puregon pen is only indicated for use with a Puregon cartridge when prescribed for subcutaneous injection. If you realize before starting the injection that you do not have enough drug in your Puregon cartridge to complete your dose, you have 2 choices. You can either dispose of that cartridge and change to a new, unused Puregon cartridge and take your dose, or you can check your treatment diary to see how much available drug is left, attach a new needle, set the dosage knob to this amount, and inject this dose as outlined previously. This should be followed by removing the needle and reloading the pen with a new sterilized cartridge. You then need to subtract the amount you have already given from your prescribed daily dose to determine how much remaining drug you need to inject from the new cartridge. Be sure to attach a new needle, check the drug flow, dial the remaining amount, and then inject that amount to complete your prescribed dose. If you realize too late, in other words after starting the injection, that you do not have enough Puregon in the cartridge, you must also take the remainder of the dose from a new Puregon cartridge. In this case, you will see that the dosage scale does not go all the way to 0 after setting and injecting the prescribed dose. The number in the dosage window will not read 0. It will read the number of units you will need to complete your prescribed dose. If you have not injected the complete dose, remove the pen with the needle attached from the skin, and then detach the needle from the pen safely. Remember to write down the position of the arrow on the dosage scale at the point where the pen stopped. This means you are recording how much Puregon is still to be injected to complete your dose. Remove the empty cartridge, as shown in Removing the Empty Cartridge. Using the dosage knob, reset the dosage window to 0 by turning the dosage knob past the 450 IU mark as far as it will turn. Push the injection button all the way in. Then, load a new Puregon cartridge and prepare the pen for injection as shown in Preparing for your injection. Dial the recorded position on the dosage scale, which is the number of units you have written down to complete your prescribed dose. Prepare a different injection site and inject the remainder of the prescribed dose. Remember, if you have any further questions about Puregon or the Puregon pen, write them down and ask your doctor or nurse.